My greetings to one and all present here. This is M. Mirudu Haashini, a 7th grader from Frontline Newgen International School. Today, I came up with an interesting topic, life during the deadly pandemic COVID-19. In the early months of 2019, the world came to a screeching halt as an invisible adversary called coronavirus. It infiltrated our lives and disrupting the norms and forever altering the course of history. COVID-19, short for coronavirus disease, is not just a medical term, but a global phenomenon that has left no corner of our planet untouched. Imagine a world where the simple act of shaking your hands or sharing a smile with a stranger could become a potential danger, where the face mask became the fashion statements and the 6 feet of distance became the new measure of intimacy. This is the world the COVID-19 introduced, a world where the people suddenly felt disconnected and isolated. This coronavirus also highlighted the weaknesses and the strengths of the healthcare systems, governments, and societies worldwide. It forced us to reevaluate priorities and rethink how we work, educate, and interact. It's a stark reminder that nature, in all its beauty, can unleash unexpected challenges. But amidst the chaos, COVID-19 also sparked an extraordinary surge of scientific collaboration, inspiring vaccine development and the groundbreaking researches. In this lecture, we'll see about the tiny virus which shook the world but also awakened the spirit of solidarity and adaptability. So, fasten your seatbelts as we embark upon this captivating exploration of COVID-19. The history of COVID-19. The name COVID-19 was derived from CO for corona, VI for virus, D for disease, and 19 for the year 2019 in December when it was first identified in the city of Wuhan, Hubei province, China. It was said that this outbreak was initially linked to a seafood market which also sold live animals, and it quickly became clear that this disease was spreading from one person to the another, leading into the growth of number of cases and eventually turning into a global pandemic. The fear, the big disease. So, as the human beings are social species which require the most satisfying environment. So, the lockdown has affected our lifestyles, career development, economic position of each countries in the world, and the economic balance was lost. The education of the children was being affected. Next, we'll see is there any relationship between COVID-19 and mental health? Yeah, there is. Along with the great increase in the morbidity and mortality due to the COVID-19 has caused the mental health issues among the general population. The adults, elderly people, young children, migrant workers, general workers, healthcare workers, and their families. So the population can experience the anxiety and worryingness, dyingness, helplessness, and blaming the people who are already been affected. Now, let us briefly discuss on the impacts of COVID-19 on the children and the adults. First we'll see about the impact on the children. So, unaware of everything, the children did not know what was happening around them. They did not know the exact reason for what have changed their lifestyle and their education. They did not know why they were sitting in front of the screen instead of going to school. The bustling hallways and the lively classrooms were replaced by the sterile glow of a computer. Few children felt so bad on this, but a few felt very happy as they were family focused. A few children were feared of their future, and the other self-motivated kids started to see some videos or the tutorials of their interest, but they have become physically less active. So this resulted in the gain of their weight and loss of cardiorespiratory fitness too. Now let us see the impact on the adults. So this age group was feared of affecting the individual, if they are affecting their loved ones, and they feared that going to job would spread the disease for them and also their family members. So these adults have decided to work from home instead of going to office. So these these adults have started taking precautions for safeguarding themselves from this disease. These adults felt very depressed and they felt very tensed as they had the restriction of meeting their loved ones and restriction on travel. The women also played a crucial role in this. So the women started to sanitize the vegetables, fruits, objects, whichever is being brought or bought from the supermarket, shops, and etc. They were sanitized properly. So this increased the burden on women and the women started to feel tensed and depressed. This caused the psychiatric problems like the mood extremes. Now let us see the symptoms of COVID-19. So these are the following symptoms of COVID-19. Fever, cough, shortness of breath or difficulty in breathing, fatigue, muscles or body aches, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. So a few patients also said that they experienced the digestive problems. Facts. The genomic studies of Spain and Italy have found that the people or the patients with type A blood group will have the risk on developing the COVID-19 virus. Fact number 2. CDC estimates up to 40% of the affected individuals are not experiencing the symptoms. COVID-19 testing. So if you have these following symptoms which I have mentioned above, you must go consult your doctor and meet your doctor and you must get tested. We should know that the PCR tests are the golden standard tests which is a very effective method. So these PCR tests are like a nucleic acid amplification test, that is NAAT, which are more likely to detect the viruses than the antigen tests. So this test will be taken by a healthcare provider and your test will be transported to a laboratory by this healthcare provider. For your results, you have to wait for a few days and you should act if you are getting negative or positive. Prevention of COVID-19. To stop yourself from getting affected from the COVID-19, you must follow these 4 steps. The first one is wear a properly fitted mask. The next one, wash your hands regularly. Avoid crowds and close contact with people, and avoid not to have close contact and maintain a social distance, that is a 6 feet distance at least. So we'll see about wearing a properly fitted mask. So in this, you have to cover your nose and mouth to prevent yourself from getting in contact with this disease. So you have to, so we have seen many people who are wearing their mask on their chins or hanging in their ears. So the main use of the mask is to cover your nose and mouth and prevent yourself from not getting affected from this disease. The next one, wash your hands regularly. We must remember that the regular hand hygiene is also very important to fight against these diseases. So an effective method of washing your hands is to use soap and water, and you must wash your hands at least for 20 seconds. If not, in case if the soap and water is not available, you may use alcohol based hand sanitizer. The next one is avoid crowds and close contact with the people. So avoiding crowds and avoiding the close contact with the people may reduce the percentage of getting affected by the people. We may not know whether the infected patients might be inside the crowd. So better avoiding this crowd can be effective method to stop yourself getting affected by this disease. The next one is following a social distance. Our scientists have said that 6 feet of distance would be the social distance for this disease. Next, facts. We should not touch our eyes, nose and mouth with unwashed hands. This may also cause infections. Fact number 2, the researchers have found that the viruses can live up to 24 hours on cardboard and 2 to 3 days on stainless steel and plastic. Fact number 3, the scientists have found that wearing a mask rapid vaccines. So we know that getting vaccinated is one of the most important thing, and vaccines save each life, million life each year. Impacts on the following factors during the pandemic. So there are nearly 4 impacts. That the first impact is impact on education. The students were really affected because of the online education. Usage of more gadgets led to the eye problems of a few children, and the children felt very bad on sitting alone in the home and attending their online classes. The children missed their playgrounds and their friends, the wonderful time they spent with each other. The next one is food crisis. So food crisis can be well known as the global food system, which has been affected nowadays. So the global food system is affected because of the following factors. Those are the closure of the restaurants, consumer behavior, food supply chain, which has been affected, the processing and manufacturing of food, food insecurity, digital transformation, food wastage, and food safety corners. The next one is the global positioning system. So many of the countries have lost their global positioning system, that they have lost the economic position all over the world. So a few countries have gone to the last rank, and still now a few countries are suffering to get their rank back. And the next impact is on the healthcare strain. So during this pandemic, every hospitals were overwhelming with lots of patients, and so that there was no adequate number of beds, PPEs, ventilators, vaccines, and a few medicines, so that the healthcare systems suffered a lot. Even we have seen news that the healthcare systems, that is the hospitals, suffered a lot without the oxygen cylinders. Next one, we'll see the advantages of COVID-19. Even though this COVID-19 is a serious pandemic, there are a few light-hearted and funny advantages. So maximum of the children and might be even some adults would have enjoyed this. The kids found very amusing on following these advantages. Advantage number 1 is the visual background. The kids enjoy the novelty of visual background, which allow them to attend the online classes wherever it may be. It might be a tropical beach or outer space. The next one is flexible schedules. The children had enough time to sleep, and they have scheduled their studies for they have chosen separate hours for studying and working in pajamas. Maximum of adults who are going to office would have experienced this. So here the adults are wearing their casual wears or the pajamas, so which leads to a comfortable working environment. Next one is no homework excuses. So due to the pandemic, the kids came up with very funny very funny excuses, and the major excuse is on blaming on the technical difficulties as they couldn't sign in their homework. And the next one is snack breaks on demand. So the children, it became very easy for the children to access their snacks whenever it may be, as they were at their home. The next one is no school bus sprints. We have seen many students from school would have been using their school bus as transport to go to school or come to home. So these children had leisurely mornings, waking late up morning, and they had no missed rides. So I would like to end my lecture by saying that even though this pandemic is very serious, there are a few advantages. So the people who have taken these advantages as positive would have not overcome any difficulties. Might be they would have not overcome any difficulties. Then we all must stay safe and stay informed. That we should thank our healthcare workers, that is the frontline heroes. So we should thank the doctors, nurses, police officers, janitors of the public health care, and the medical center workers. So thank you all for your sacrifices. These people have worked for us 24 hours and they do not have proper time to spend time with their family, even though they have sacrificed those times with us. So we should thank all these frontline heroes. So as I bid you all with the heartful wishes of healthier and happier future. Thank you.